So let's talk about fentanyl really quick. Fentanyl is a common medication used in hospitals and in surgery centers and ICUs for pain management. It can also be used in conjunction with medications like Versed or with propofol for sedation. But let's talk about what it is. So it's a supplement to general anesthesia, and it can be given continuous IV infusion for purpose of analgesia. And then when you combine it with these medications like Versed or with propofol, it can be used for sedation. So a lot of times in an ICU setting, you'll see Versed and fentanyl drip. And you know, your max with fentanyl is about 200 micrograms. And with your Versed, you know, it's about 10. So you really got to be careful that you're titrating the correct one when you're messing with these medications, when you're messing with the pump. So make sure you have your lines ID'd and labeled really, really clearly with what's going through what IV. So the action is that it binds to opiate receptors in the CNS and alters our perception of pain. And by doing this, it produces a general CNS depression. So by just providing this general depression of our central nervous system, it is able to alter our perception of pain. So therapeutic class is opioid analgesic. Pharmacologic class is opioid agonist. Some things that we want to keep in mind as a nurse, and we talk about this with all of our CNS depressants, but we really want to watch for apnea, decreased respirations, bradycardia, hypotension. So we're looking at our respirations, we're looking at our cardiovascular system, we're making sure that we're not depressing the system too much. So, for example, if you do have a patient on Versed fentanyl, the patient will hopefully be ventilated, so they're getting that respiratory support, and they may be on other vasoactive drips to kind of keep their cardiovascular system up. So, but if they're not, you know, if we're giving any of these CNS depressants, especially fentanyl, you know, we want to make sure that we're monitoring their EKG, we're monitoring their respirations, and we're making sure that they're safe. Okay. With a lot of medications too, you don't want to consume grapefruit juice while taking fentanyl. You want to monitor our hemodynamics very, very closely and assess our patient's pain. If we do have the patient sedated, we'll want to use other methods to assess pain, like FLAC. You know, what's their respiratory rate, what's their facial expression, and these types of things to try to determine, is the patient having pain, even if they're nonverbal or even if they're sedated. So we can still assess pain, and we still should assess pain, especially if we're giving these types of medications. If we don't want to just pump our drip up and sedate the patient to where they're doing nothing, we want to make sure that they're still going to be responsive if they are. Okay, so that's really fentanyl. That's really the purpose of it. That's why we're giving it. The times that I've seen it the most are in conjunction with other drips to help sedate patients. And to help manage pain after like a massive trauma, after car accident, after head trauma, or whatever it is, that this would be the times that I've generally seen it the most. But this is fentanyl, trade name Sublimaze. This has been another episode of the Nursing.com MedMaster podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.